is Teresa Scott, and today we're going to be doing the final head to toe assessment. First thing you want to do whenever you're doing a head to toe assessment, you first want to wash your hands, prepare your material if you have any, and then you want to come into the patient's room and explain to them what you're going to be doing. So, Mr. Scott, my name is Teresa. I'm going to be your RN today. Today we're going to be doing full head to toe assessment. With the assessment, I'm just going to be going through the different body portions, assessing you pretty much. And then earlier the aide came in, they did your vital signs, your blood pressure, everything was normal. Blood pressure was 124/72, so no hypertension there. Respirations was normal, there were 16. Your did you state that you were in pain? Are you having pain?
No, ma'am.
Level of pain is 0 out of 10. Your temp was 97.9. They took that by mouth. Your heart rate was 81. So all of those things are good. So now that we've done that component, first thing to do is I'm just going to test your level of consciousness. Can you please tell me your name?
Stephen Scott.
Okay. Can you tell me where you're at?
I am in Bryan, Arkansas.
Okay. Can you tell me what year it is?
2016.
Can you tell me today's date?
Today is May the 5th.
All right. Here we go. Patient is alert and oriented ×3. Next thing we're going to do on our agenda is we're going to start the head to toe assessment. First thing you want to do is you want to start with the head, of course, and you want to look at the patient's head, making sure that it's normal cephalic. Then you want to look at their scalp, making sure you don't see any lesions, open skins. And then you want to look at the texture of the hair. Hair is fine texture. He does have a slight thinness of hair noted towards the center, where everything is evenly distributed. Then after we do the head, we work our way down to the face. You want to make sure the face is symmetrical. Face is symmetrical, both sides. You notice that the eyebrows and the eyes are both symmetrical. You want to make sure the nose is midline with the face, in which it is. And you also want to test for patency of the nostrils. So at this point, I'll have him occlude each nostril. Sniff for me. Next one. Okay. So his nostrils, they are both patent bilateral. Then we work our way down, looking at the mouth. Notice with the mouth, the lips area, we don't notice any cracking of the skin or anything like that. No open sores or lesions noted. Then his mustache and everything is evenly cut. No facial hair noted. The ears are symmetrical to the face as well. And as we look at the mouth, we'll ask him to open up his mouth for us. Then in his mouth, we want to look to make sure that everything is, as far as, can I see your tonsils? His tonsils are intact. They don't look swollen. His mouth is pink and moist. He has all his teeth, so no missing teeth or cavities noted. And then we move on to the ears. With the ears, we want to palpate it at the auricle, then work our way down. Any tenderness?
No.
And then at the tragus, any tenderness there?
No.
Okay. Next, with the ear, we want to look inside. He does have a slight cerumen noted. And bilateral ears. Then after we complete that portion, we then move our way down to the neck area. And also with the face, you also want to palpate here for any type of for the sinuses, facial and maxillary sinuses. You feeling pain here?
No.
So no pain there noted, so everything is good. I did notice that on the forehead area, he did have a little bit of dry skin noted up here, but his skin is warm to touch. So that's good. So as we, and it's symmetrical in color. So as we move down, we're going to move to the neck area. The neck area, we're just going to palpate some of our lymph nodes. Tonsillar, can you swallow for me? Okay. Tenderness noted here? Okay. And then at this point, we'll listen to the carotid artery. And with the carotid artery, we're going to use the bell of the stethoscope. And you just first you palpate. You do it one at a time, making sure that the rate and rhythm is equal in strength. Then you take the bell of the stethoscope and you listen. And you're making sure you don't hear any bruits or anything like that. I mean, hear any bruits or anything like that, which is a good finding. And then also, since we're in the neck area, we do the occipital lymph nodes. Any pain here?
No.
Okay. And then we do pre-auricular. Any pain here?
No.
Post-auricular. Any pain here?
No.
We did the tonsillar, which is good. You did the submental. Any pain?
No.
Submandibular. Any pain?
No.
And then we got to go deep in here. That's where we do like the supraclavicular. Any pain here?
No.
And that's just some of our lymph nodes as we complete that portion. Now after we complete the head, the neck area, our next thing on our agenda is the chest area. And with the chest area, we just want to make sure that we're listening to the anterior, posterior, and the lateral lobes of the lungs. At this point, we'll take the stethoscope, have the patient breathe in and out, working our way from left to right. Now we do the lateral lobes. Put this on for me. I'll put that on. Okay. Then we listen to the back the same way, going through each section, making sure that we cover everything. And that's with the anterior, posterior, and lateral. As far as what I said, AP and L are clear, lobes are clear, no adventitious breath sounds noted, no dyspnea, labor breathing noted as well. And then while we're here, we're checking the skin turgor, no tension noted, so that's good. And then also, whenever we listen to the lungs as well, we want to make sure we check the, sorry, can you turn for me, the diameter of the chest. And we will do that in by having the patient take a deep breath, breathe in and out. So, you know, that is good. Just diameter. Well, as far as chest expansion. Next thing on our agenda is listening to the heart sounds. And with this, I'm going to have him set up for me and then listen to the heart sounds. Okay. I guess before I start is whenever we listen as far as the heart sounds, we always want to, at this point I will lift up his shirt and then I'll check for any pulsations, any visible pulsations that I can see. And then after that, we listen to the heart sounds. We have our aortic, which is in our second intercostal space on the left side. Then we move, on the right side. And then we move over to the pulmonic, which is in the second intercostal space, the left sternal border. Then we move down to the Erb's point. Pulmonic. Erb's point, which is the third intercostal space, left sternal border. Then the tricuspid, fifth intercostal space, left sternal border, and then the mitral, which is our fifth intercostal space, mid-clavicular line. And at that point, we would then palpate for the PMI using the diaphragm and then the bell of the stethoscope. So I'm going to listen to those. at this point, I will listen for a full 1 minute. And after that, I will have him lie down for me. Then as he lie down, then I will go back and listen to the EMI area over here. I will listen for a full minute, and then that will be done with the bell of the stethoscope. And after completing that segment, then I move on to the abdominal area. With the abdominal area, at this point, have the patient to lift their shirt. You don't flip. Have the patient to lift their shirt, and then once they lift their shirt area, then I will inspect their skin for any hair, scars, piercing, any vascularities, lesions, and then we will note the contour of the belly, which his is flat as far as the belly area, and then umbilicus areas, his is inverted, and then looking for any visible peristalsis or pulsations, which there aren't any, and then I would listen to his bowel sounds with my stethoscope. And when you listen to the bowel sounds, we do the right, then left upper, right upper, left lower. Everything sounds normal there. Audible bowel sounds times 4 quadrants. So that's good there. They're normal, active. Then at this point, I will perform a light palpation of each quadrant. Palpating each one. Any pain or tenderness?
No, ma'am.
No. Okay. After palpating each quadrant, then I'll do a deeper palpation of each quadrant. In our right lower, we have our right lower, we have our appendix. Any pain here?
No.
Okay, right upper, gallbladder area. Any pain here? Then moving to our left upper, stomach. Any pain here?
No.
Then moving to our left lower, sigmoid, colon. Any pain here?
No.
Okay. So with the deeper palpation, there's no pain noted. So after completing the abdomen, next step will be the peripheral vascular area. At this point, I'll inspect his hands. With the hands, while I'm doing it, looking at the skin, as you can see, feel it's warm to touch. It does have some dry skin noted to both hands. Looking at his nail bed, fingernails are trimmed on both hands. The concave on his fingernail bed is less than 160. The color is pink, and as I press down, capillary refill time is less than 3. And I also do it on his feet as well. Looking at his feet, I'll take off his socks, and then looking at his nail bed as well. And then I will also look at making sure that the toes are trimmed evenly, and then do the capillary refill time as well on his toe area. So after we complete that, then feel for his radial pulses. Both then are +2 bilateral equal in strength. Then feel for his brachial. After we do the brachial, we'll move on down to the feet. And the feet, we'll do the dorsalis pedis. Palpate about right here. And his is bounding bilateral. So his is about +3. So it's a little bit more stronger than normal. And then I'll do his posterior tibia about right here. And doing it on the side of the ankle. Well, it's hard to feel it, so it's about a +1 for both of those. And after we do the peripheral vascular, and we assess the skin temp, and do the pulses. And from that point, this pretty much completes the head to toe assessment as far as the head and neck area, the chest, and then the peripheral vascular system.